Assalamu alaikum, dear audience. I am Professor Shamsuzzaman, Professor of Pathology, Rangpur. I welcome all in today's lecture on pathology. This is my 12th lecture. We are discussing about the different types of irreversible cell injury, that is cell death. In the last lecture, that is in the last 11th lecture, I have completed briefly the different types of necrosis. Today come to apoptosis. Apoptosis is another type of cell death. It is called dropping off. Dropping off. Now come to what is apoptosis first. Apoptosis means elimination of unwanted host cell through a series of events. So it is elimination of unwanted host cell through a series of events programmed by a dedicated set of gene is called apoptosis. So it is the elimination of unwanted host cell. When a host cell in our body become unwanted, that is when the cell cannot perform anatomical activities, physiological activities and biological activities, biochemical activities, this cell become very much unwanted. This unwanted host cell is eliminated from our body through a series of events, and all the events are programmed by a dedicated set of gene. This elimination of unwanted host cell is called apoptosis. Now come to, if this is a cell well functioning or normal functioning, if this host cell become unwanted, this cell cannot perform the activities. This cell will be eliminated from our body through a series of events, and all the events will be programmed by a set of gene. That set of gene is present in that cell. This cell which will be eliminated from the body, this cell contains the set of gene. This gene that makes the program, this gene also is eliminated from the body. So this gene is called dedicated set of gene. It is called dedicated set of gene. So this is apoptosis. Now come to types of apoptosis. It is two types. One is physiological apoptosis, and another is pathologic apoptosis. Now come to first physiological apoptosis. You know, during pregnancy, within the uterus, the number of cell is increased. This is called hyperplasia. This hyperplasia of the cells in uterus is very much unwanted during pregnancy. After birth of baby, the uterus come back to normal state. There is involution of uterus, and the cells that were proliferated or that was proliferated during pregnancy, all cells become after pregnancy becomes unwanted. These cells are eliminated from the uterus by the process of apoptosis. So this is physiologic apoptosis. Example one is involution of uterus. Involution of uterus. Again, I can say during pregnancy, increased number of cells in the uterine wall is needed, is very much essential to continue the pregnancy. After pregnancy, the additional number of cells is not needed, becomes unwanted. These cells are eliminated through the process of apoptosis. Thymus. You know, after certain age, we have no thymus. It may be rudimentary. As the thymus become unwanted, it is eliminated, the cells of thymus is eliminated from the body through the process of apoptosis. Now come to pathologic apoptosis. Example, virus infected cell, and cancer cell when treatment like chemotherapy or radiotherapy is given. When chemotherapy or radiotherapy is given. Radiotherapy is given. First come to virus infected cell. Virus infected cell. If a cell of our body is infected by virus, this cell is called virus infected cell. If this is the virus infected cell, this is nucleus, this chromosome containing DNA, etc. And this is the virus infected cell. This is the virus infected cell. What is the outcome? What is the fate of virus infected cell? One of the outcome or one of the fate of virus infected cell is apoptosis. So now come to fate of virus infected cell. Number one fate is return to normal state. The virus infected cell may turn to normal state again when if the virus damages DNA. If the damaged DNA is repaired, then the virus infected cell come back to normal state. When the cell return to normal state, when damaged DNA is repaired. Another fate, if the DNA undergo mutation due to virus, if the virus is very much capable to cause mutation of the gene or mutation of the DNA, this mutation cell containing the mutant gene or mutant DNA may progress to neoplasm, turn to neoplasm. So virus infected cell may turn to neoplasm when DNA, that is gene, undergo mutation. We know the molecular basis of carcinogenesis, molecular basis of tumorigenesis is the genetic mutation. So, if there is genetic mutation, either by virus or by any sorts of carcinogen, there is chance of development of neoplasm. The third fate of virus infected cell, if the damaged DNA is beyond repair, or if there is no genetic mutation, then the cell become unwanted and the cell undergo apoptosis. The third one is apoptosis. When apoptosis, if damaged DNA is beyond repair, or no genetic mutation. So, if the virus does not cause a genetic mutation, or if the damaged DNA is beyond repair, the cell undergo apoptosis. So, this is the examples of apoptosis. Now come to apoptosis of cancer cell. Following chemotherapy or radiotherapy, Suppose there is a huge mass, this cancer is a cancer in any organ of the body. If the cancer is exposed to chemotherapy or exposed to radiotherapy, the cancer size is reduced, because the cancer cells, within the cancer cells, apoptosis is stimulated by the chemotherapy, or apoptosis within the cancer cell is stimulated by the radiotherapy. Once apoptosis is stimulated within the cancer cell undergo apoptosis or eliminated from the body through apoptosis. So, when cancer is treated with chemotherapy or radiotherapy, apoptosis occurs within the cancer, so the reduction of the size of the cancer. Now come to what are the steps of apoptosis. Steps of apoptosis. Suppose this is a normal unwanted cell, this is unwanted host cell. This is unwanted host cell. This cell is very much unwanted. This cell by definition will be eliminated from the body by the process of apoptosis. The first step is shrinkage of cell. Shrinkage of cell. The cell becomes shrinkage. The cell becomes shrinkage like this. Shrinkage of cell. Later on, if this is the nucleus of the cell, the chromatin undergo condensation and peripheral orientation. Condensation and peripheral orientation of the chromatin. So, within this cell, there is condensation of chromatin and peripheral orientation of the chromatin. Condensation and peripheral orientation of chromatin. So, in the second stage, the chromatins undergo condensation and these are oriented to the periphery of the nucleus. Later on, what happens? There is fragmentation of nucleus. Fragmentation of nucleus. Fragmentation of nucleus. The fragmentation is more than one. 2, 3, 4, 5, etc. So if in the third stage, this is the cell, so this is the nuclear part, this is fragmented nucleus. There are 4 fragmented nucleus. Later on, formation of apoptotic body. Formation of apoptotic body. Formation of apoptotic body. How these apoptotic bodies are formed. Now come to how the apoptotic bodies are formed. How apoptotic body is formed. First, bleb is formed. Bleb is formed. Suppose this cell, first there is cytoplasmic blebs like this. This is bleb, and the nuclear fragment. Nuclear fragment. Bleb is first is formed, and from the bleb there is cytoplasmic fragmentation and formation of membrane bound bodies. Lateral fragmentation of cytoplasm and formation of membrane bound body and formation of membrane bound bodies. Fragmentation of cytoplasm and formation of membrane bound bodies. These membrane bound bodies are called apoptotic body. Apoptotic body. These are called apoptotic body. So there will be formation of apoptotic bodies, and these apoptotic bodies are engulfed by macrophage. This is the macrophage. You know, in our body, in each tissue there is macrophage. The tissue where there is apoptosis, the apoptotic bodies are formed. The apoptotic bodies are engulfed by the macrophage. So this is the steps of elimination of the unwanted host cell. Then what will happen here? Lastly, the apoptotic bodies are engulfed by the macrophages. Apoptotic bodies are engulfed by macrophage. Now come to apoptotic body. Apoptotic body. It is membrane bound body composed of cytoplasm, then tightly packed cell organelles, and third one, the apoptotic body may contain or may not contain nuclear part. May contain or may not contain nuclear part. So this is the apoptotic body. We can cite an example. Suppose this is a chapati. This is the egg post in the center, This is egg yolk, egg post, and there is another curry like this curry like this. You're going to take this chapati, egg post and curry at a time. You have to make piece, and within the piece you have to take a fragment of egg here, a part of curry is here, and then you should take it and you have to engulf it. Finally, if you get the last portion of this chapati, you have curry here, but you are getting no part of egg here. So this will be devoid of part of egg. So if you consider this is apoptotic body, this is also apoptotic body, this apoptotic body containing the curry, that is cell organelles, containing cytoplasm, part of egg, but this apoptotic body containing cytoplasm, containing curry, but no part of egg. So apoptotic body may contain or may not contain nuclear part. Now come to what are the differences between necrosis and apoptosis. You know, necrosis is cell death, apoptosis is also cell death. But what are the differences between necrosis and apoptosis? What are the differences? First one, you can define what is necrosis and what is apoptosis. Then cell swelling. Cell swelling present in apoptosis, in necrosis, and absent in apoptosis. No cellular swelling. Then cell shrinkage. In necrosis, cell swelling, no shrinkage, but shrinkage present. Now come to nuclear changes. Nuclear changes. You know, in necrosis, nuclear changes is pycnosis 1, pycnosis, karyolysis, and karyolexis. But in case of apoptosis, there is condensation of chromatin and fragmentation of nucleus. Condensation of chromatin and fragmentation of nucleus. Then cytoplasmic membrane. In case of necrosis, there is a disruption of cytoplasmic membrane. Disruption. But in case of apoptosis, no disruption, rather cytoplasmic membrane is intact. What are other differences? Apoptotic body formation. Apoptotic body formed here, that is present, not formed, that is absent. Type, necrosis may be both, it is always pathological, but apoptosis may be physiological and pathological. Necrosis pathological, but apoptosis both physiological and pathological. Then sign of inflammation. Sign of inflammation. In necrosis, sign of inflammation present, but in apoptosis, sign of inflammation absent. What it means? We know both necrosis and apoptosis may occur in liver. If anybody suffers from necrosis within the liver, suppose this is liver like this. Suppose this is liver like this. If there is necrosis here, the adjacent tissue undergo reaction, and this reaction of the adjacent tissue is known as inflammation. So sign of inflammation is present in necrosis. If anybody suffers from necrosis of the liver, patient will feel a rise of temperature, patient will feel pain. So rise of temperature, pain, these are the sign of inflammation. So sign of inflammation is present in necrosis, this is absent in apoptosis. Now come to why sign of inflammation is present in necrosis and absence in apoptosis. Why sign of inflammation is present in necrosis but absent in apoptosis. Again, we recall both necrosis and apoptosis, both are cell death, but in one cell death, that is in necrosis, there is sign of inflammation, but in apoptosis, no sign of inflammation. Suppose this is the tissue, this cell undergo necrosis. N means necrosis. This is the tissue, this cell undergo apoptosis. I have told you in necrosis there is disruption of cell membrane. As the cell membrane is disrupted, so cytoplasmic substances are released from the cell to adjacent tissue, released from the adjacent tissue, and the cytoplasmic substances also contains enzymes and toxins. Due to toxins, the adjacent tissue undergo reaction, and this tissue reaction is nothing but inflammation. As toxins are released or come out from the disrupted cell membrane from the cell, through the disrupted cell membrane from the cell, so the adjacent tissue undergo reaction, and so sign of inflammation like pain. But in case of apoptosis, there is no disruption of the cell membrane, rather there is formation of apoptotic body, all are containing the intact cell membrane. So there is no release of toxins from the cell, so there is no sign of inflammation. In necrosis, there is release of cytoplasmic substances as toxins or something like. It is helpful in many diseases in diagnostic purpose. In necrosis, I have told you, as there is disruption of cell membrane, certain substances are released from the cytoplasm of the cell, and this helps in diagnosis of disease like myocardial infarction. Like myocardial infarction. Again, I recall in necrosis, as cytoplasmic substances come out, it may come out in blood also from the tissue, and these substances helps in diagnosis of disease. Example, myocardial infarction. You know, this is the cardiac muscle, this is the cardiac muscle, this is the cardiac muscle. If there is myocardial infarction, what will happen? You know, cardiac troponin I. Cardiac troponin I come out of the cell in the blood, in the tissue, ultimately in blood. And this cardiac troponin I helps in diagnosis of myocardial infarction. Now come to, I have told you, Apoptosis and necrosis. Apoptosis means, again I recall, elimination of unwanted host cells. So it is helpful for us. It is helpful for us. If there is defective apoptosis may enhance carcinogenesis. Now come to defective apoptosis and neoplasm. Defective apoptosis and neoplasm. Suppose this is a cell, this is nucleus, these are chromosomes. Suppose this is P53 gene. You know P53 gene is called tumor suppressor gene. This gene, controlling gene, this is also called wild gene. This gene prevents carcinogenesis. If any carcinogen causes mutation of P53, by any carcinogen, if there is mutation of P53 by any carcinogen like virus, then we call the cell containing mutant P53. And I have told you genetic mutation is the molecular basis of carcinogenesis. So once the gene undergo mutation P53 in the cell become a bit unwanted. If the cell undergo apoptosis, there will be no carcinogenesis. But if there is defective apoptosis, if the apoptosis is delayed, then the cell may progress to neoplasm. In briefly I have told you. So defective apoptosis is associated with neoplasm. So this is all about the apoptosis. Today up to this, thanks all.